Hello, my name is Ahmad Masri. I'm a cardiologist and a cardiomyopathy specialist at Oregon Health and Science University in Portland, Oregon, United States. The non-obstructive HCM population is a large segment of hypertrophic cardiomyopathy, and the challenges are that there have not been any treatment proven to successfully lead to improve in feel and function of this population. And as such, we truly don't have options to treat symptomatic patients. And the big challenge is these symptoms represent exercise intolerance, shortness of breath on exertion, inability to do daily activities. And as such, we really are in need of new therapies that can address these limitations to the life of these patients. FOREST-HCM is the long-term extension study of patients who receive Aficamten in a parent study. And there are two parts of the study. There is the obstructive HCM group and there is the non-obstructive HCM group. So focusing on the non-obstructive HCM group, patients who were enrolled in the parent study, which was Redwood HCM cohort 4, were invited to participate in the long-term 5-year extension of FOREST-HCM. Patients were screened and then enrolled. They had a titration period, typically in the first 6 weeks, to the maximum tolerated dose. And then after that, there is the chronic follow-up phase, which used to be once every 3 months, but now it's once every 6 months to make sure that safety and efficacy can be assessed during these visits. So the key findings of this most recent presentation is that in hypertrophic cardiomyopathy, especially non-obstructive HCM, you really care about the performance of medications, not just acutely, also over an extended period of time. And this analysis goes all the way out to 96 weeks or almost 2 years, looking at the safety and efficacy of Aficamten. And so the primary results were the fact that patients tolerated the highest dose of available highest doses of these drugs, 15 and 20 milligrams. Or more than 80% of the patients were on these, and we just used pure echocardiographic criteria to up-titrate, so very simple real-world kind of an approach. The second finding is that about 80% of the patients had improvement in NYHA class, which is important because the typical placebo effect across all studies ranges between 30 and 40%. So this far exceeds what can be observed from placebo. Out of these patients with improvement in NYHA class, a lot of them became asymptomatic without any symptoms. So NYHA class 1, another hard goal to achieve usually. And then KCCQ also improved by 11 points. Now, these were supplemented by biomarkers of wall stress, which is NT-proBNP being reduced significantly. The proportional change was close to 0.3, so really quashing down that NT-proBNP elevation. And then troponin had a similar trend as well. And then in terms of safety, which is really important, and one can argue it's one of the important pieces of long-term exposure, is there are fears of what can a drug that can affect systolic function, what ends up happening. We saw from Odyssey, almost 22% of the patients had reduction in their ejection fraction below 50%. So what we saw in this study is that there was a modest reduction in LVEF on average 5% over these 2 years, remained within the normal range for the majority of the patients. There were 4 patients with reported LVEF less than 50%. 2 of them were asymptomatic and dealt with by down titration of the drug to the next available dose. And 2 of them were in the setting of atrial fibrillation or procedures to treat atrial fibrillation. More importantly, when you look at the core lab evaluations of the echocardiograms, which is the way that the pre-specified safety reporting is, only 1 patient out of 34 patients had an EF less than 50%. So in summary, the results show that, the Aficamten use was associated with significant improvement in symptoms, quality of life, biomarkers, while maintaining that robust safety that we have seen from other obstructive HCM trials. This trial over 2 years gives us hope that we are still on the right track in evaluation Aficamten for the use in non-obstructive HCM patients. Obviously, this is a small study, not placebo-controlled, but it does provide wealth of data. And so we are eagerly awaiting the results of the Acacia HCM trial, which is a phase 3 trial, placebo-controlled, almost 500 patients, and we are awaiting this trial next year. So the results here really support the ongoing study and support the continuation of treating our patients in FOREST-HCM with Aficamten. So the key takeaway message is that Aficamten was safe and effective in the non-obstructive HCM population, and these results need confirmation in a large phase 3 trial.